Hello, welcome to the evening talk with the desire to discuss the non-medical management of irritable bowel syndrome. Before I go into that, the concept of irritable bowel syndrome is very common and it is worldwide in distribution. About 3 out of 10 persons in developing countries have irritable bowel syndrome. And based on well-publicized data, 1 or almost 2 out of 10 within the Western populations have irritable bowel syndrome. It is thus a very common condition that deserves a lot of attention. My name is Ladeb. I'm a gastroenterologist. I've done some research work on irritable bowel syndrome, and I've actually published some papers that is been reviewed within the peer journals scientifically. I have seen quite a number of persons who have suffered this condition and do desire a lot more support than they're getting. I do think that doctors are doing their best. However, this is to supplement some of the actions and activities that they've been doing. Now, what is irritable bowel syndrome? The name irritable just means it is cantankerous. In other words, it's unpredictable. It is a bowel that is just not listening and would just not respond well. And bowel, of course, talks about the intestines, in particular the large bowel. And a syndrome because there is no definite diagnosis or a kind of a blood test or some kind of x-ray or some imaging that could say this is irritable bowel. So it is based on a syndrome, a constellation of symptoms coming together to define it. And this has been well researched by specialists internationally. And it's been agreed that if a patient satisfies certain criteria with an exclusion criteria of certain prominent situations, then they are taxed to have irritable bowel syndrome. So this is often a condition associated with abdominal pain and or bloating, the onset of which is associated with a change in bowel habit. That change can either be constipation or diarrhea, that is, the stools are loose, or a mixture of both. So there are 3 forms, that is diarrhea predominant irritable bowel syndrome, and then the constipation predominant irritable bowel syndrome, and then you have the mixed type, alternating type of irritable bowel syndrome. Now, a patient can switch between all the categories within their lifetime. And so sometimes patients say, oh, my irritable bowel syndrome has never been like this. Why am I feeling like this? Okay, again, I said it is a cantankerous bowel. It does not do what you want. What causes it? There are theories. It's not known how it comes about. However, there are theories. Prominent among these theories is the brain-gut hypothesis, where some signals from stress factors within the brain will stimulate the bowel to behave irrationally, and then it becomes irritable. There's also the neurotransmitter theory, and there's also post-infectious or post-inflammatory theory, where there is a previous inflammation of the bowel, and then the bowel responds by becoming very irritable and not uncoordinated and creating all the kind of thing. Now, the problem with irritable bowel syndrome is not that it causes death. In fact, it is compatible with normal life. You do not die from irritable bowel syndrome. It should never cause you to have any complications such as electrolyte abnormalities or dehydration. What it causes is the misery that it brings to those who suffer it, and therefore it deserves attention. There are lots of manpower losses because the sufferer of it may not be able to enjoy their work pattern, and therefore they're not able to contribute to society. And of course, there's lots of time they need to search doctors and so on. And so that is the short introduction about the condition. Now, I mentioned about certain components that needs to be ruled out before this diagnosis is reached. And so there are alarm symptoms, such as when you notice blood in the stools, or there's a hard mass in the abdomen, or some basic stool or blood test that shows absence of anemia or an inflammatory marker known as fecal calprotectin when it's done, and these are within normal range, then there's no much worries again. Based on the satisfaction of the criteria which has been internationally agreed upon, this diagnosis can be confidently made. Some of the simple tests one can do would be thyroid function test, as well as celiac antibody screens. These have all been internationally agreed, and it's been shown that it's almost 100% perfect in making a diagnosis of irritable bowel syndrome. So it is not a diagnosis of complete exclusion, but of course there might be slight errors in that diagnosis, but I believe so far the evidence before us gives room to this criteria, known as the ROM criteria, to confidently make this diagnosis and to commence treatment. The big challenge comes when the sufferer continues to believe that there is something that is being missed, which again complicates the whole cycle of the bowel believing, or the mind believing there's something unusually abnormal, and therefore stressing the bowel again, and the cycle continues. And of course, we do know there's a strong link between irritable bowel syndrome and depression or anxiety disorders. There are other symptoms linked to it as well, but this suffices. So when you go to see a doctor, what do you discuss? Most of the discussions bother about the bowel pattern, how it has changed over time. The doctor will ask you a few questions related to whether you're having heartbeats fast or dizziness or any of the presence of blood, and they will examine you for any masses or any alarm symptoms, or any family history taken as well. Sometimes diet can contribute as well, so those are obtainable during your consultation. The simple blood test or simple tests that can be done to rule out or quickly be certain that nothing is being missed will include what I've mentioned already. For clarity, I will repeat them again. Full blood count, as well as thyroid function test, and if there's a diarrhea predominance, there is necessity to rule out any inflammatory activity within the bowel by doing a fecal calprotectin. Once the result returns and it shows that these are normal and you have not lost any significant amount of weight, then it is important to just go ahead and make this diagnosis and begin therapy. The treatment of irritable bowel syndrome does not have a one fix-all situation. In other words, it is variable and depends on each patient's circumstances and the predominant symptom that is enduring on any particular person. For example, you cannot treat the patient with constipation the same with the one who has diarrhea. And so these are tailored, and it's best done within the general practitioner system. On occasionally, those who fail to respond very well with the general practitioners are referred to the gastroenterologist, who can give more opinions or advice about how best optimize the quality of life of the sufferers of this condition. Now, of course, the topic today is to actually discuss about non-pharmacological management rather than the pharmacological ones. I'll leave the pharmacological treatments to specialists, and that is when you need to go see them. But there are many things that can be done, things that you can do for yourself, 2 things that you can do when you're eating, and 3 things that you have to embark upon. What do you do for yourself? 1, accept the diagnosis. Denial can be very, very painful, can be sore, and it can actually spark off a cycle of concerns and depression and anxiety, and does not help recovery from irritable bowel syndrome. Obviously, when I mention recovery, I'm talking about control. In a few cases, some people outlive irritable bowel syndrome. For some unfortunate ones, they continue to have the symptoms for the rest of their lives. However, a lot of persons, when they've learned to cope with understanding and accepting the diagnosis and going ahead to living with it, they're able to cope better. What can you do in terms of food? There are things to avoid and there are things to eat better, to eat. Foods that are commonly linked are variable as well. In other words, some people find milk or onions or beans or tea or things variably, sometimes gluten products, even without the presence of celiac disease. They have noticed that whenever they take these foods, their symptoms become flared, in which case you need to avoid them. Very common things that we tell patients to avoid would include coffee or any caffeinated drinks, carbonated drinks, Coca-Cola, for example, and there are also basic stuff that would be available if you go onto internet and seek, such as a low FODMAP diet. There's a big list of diets that you should eat, and there are the high FODMAP diets, which have a tendency to flare irritable bowel syndrome, that I would ask if you can go check it. It would be very, very helpful for you. Research has demonstrated that about 50% of persons who have the diarrhea predominant type, IBS, have found significant relief when they embarked on this low FODMAP diet. The only disadvantage with it is that it needs you to be in the kitchen yourself. You take control of your food. You don't depend on people doing it for you. And that is the best, the Herculean task linked to this kind of management. However, it's been shown by research that it works. What are things that you can do in terms of your mindset? Yes, meditation, deep breathing, just learning to cope with cognitive behavioral therapy and understanding the circumstances about the fact that this does not lead to death. That alone can allay your fears and make you able to cope with this condition. There are many other things which, of course, if you check our page on Facebook or on the internet, on our website, you would find some helpful information that would be able to support you, and you can live with this condition well. Moreover, you can also send me information when you like our page or you follow us on our page. We will be able to update you with information. You can ask us questions and we can get back to you to be able to answer these questions and probably help you cope with this condition. I can assure you that we answer within minutes or when you get in touch with us. Now, I talked about prognosis. In other words, this is not a condition you can die from. So just lay aside any anxiety linked to this condition. It would be controlled, and it can be controlled, and it has been controlled. A lot of persons will get better with these non-pharmacological therapies. The rest of patients will need some kind of help, which would mean medications. And most of these medications are non-addictive, and they are sometimes able to reboot, as it were, that is, restart the system in such a way that you may not even need the medications at some point in your life. Of course, a lot of women suffer this condition more than men. For whatever reason, we're not sure, but it has been also documented that women who are non-pregnant, whenever they get pregnant, in other words, when they have babies, then it tends to change the system. It's possible that there's a hormonal link that makes it easier for women to have this condition more than men. But this research continues, and if there's any more information, we'll let you know about irritable bowel syndrome. I will be very happy for you to link up with us. And also, we've got an app, Abdominal Pain Checker, which has some of this information that you can access and be able to recognize and help yourself live comfortably with irritable bowel syndrome. And we will support you in whichever way we can. Thank you very much for the evening, and thank you for listening. Don't forget to subscribe to us. We will be happy to welcome you on board and be on our page. Watch out for the next presentation. Thank you. Thank you. Bye.